Assalamualaikum warahmatullahi wabarakatuh. We are from Group 8. Today we would like to present our case study on IV bottle contamination by Abbott Laboratories. My name is Muhammad Fazli bin Abdul Hadi. I would like to explain a little bit about the background of IV bottle. Intravenous, or we call IV, is a type of solution that is quickly sent a medication directly into the bloodstream. There are several types of medication that can be given by IV. First is chemotherapy, drugs and antibiotic. The example of IV side effect include infection and blood clotting. Abbott Laboratories is one of the oldest and successful pharmaceutical companies in US. They also is a top manufacturer of medical diagnostic equipment. So what happened in our case study? The container with new screw cap closure contaminated caused by Enterobacter cloacae bacteria. It is found that patient in 8 US hospital has positive in blood poisoning, or we call sepsemia. In this incident, it caused 434 infection and 49 death. So why is IV bottle contaminated? During production of IV bottle, the water used for cool down after sterilized contain higher bacterial count than manufacturer established limit. IV bottle also rinse with municipal water without receiving bacterial treatment. So, from the new usage of screw cap, it exposed leakage of microbial through these two processes.
My name is Muhammad Luqman bin Yusuf. I will explain to you about the chronology of the FDA action against the Abbott Laboratories. First, FDA at 25 April 1969, FDA became aware and examined that a problem existed with IV bottle known as LVB's manufacture. 12 May 1969, FDA start to inspection on Abbott Laboratories. 3 June 1969, FDA took an action to advise Abbott of the deficiencies. Next, on 2 February 1971, an FDA memorandum to remove any objective evidence claim using the defective containers. Next, FDA take an action on 12 March 1971, which is CDC, FDA, and HEW and Abbott officials met and discussed about the IV contamination of the bottle. In 13 March 1971, FDA and CDC each issue formal public statement about the IV bottle contamination. 22 March 1971, FDA issued a press release recommending that all hospitals to expeditiously shift from the use of the Abbott IV bottle. On 22 March 1971, FDA requests Abbott to recall 105 IV bottle products. On 22 March 1971, FDA inspection on Abbott once again caused Abbott to be required to halt its production of the IV bottle package. In June 1971, FDA once again allowed to Abbott to resume commercial sale and distribution of his IV bottle due to switch to a rubber stopper type closure. So, FDA have developed manufacturing and testing protocols need to be followed by Abbott to continue their IV bottle.
Hello, my name is Luqman Al-Hakim bin Abdul Hakim, DN 160354. So what Abbott action to prevent the situation? First, what Abbott action for the corrective on this situation? First, they work with FDA and CDC as a response of the situation in this case. Then a board recalled all 3.5 million bottles of IV fluid from the market. Litigation resulted to 1,000 fine to a board company. A board and then redesigned the IV bottle seals by replacing screw cap with rubber stopper cap, and then they implement proper current good manufacturing practice on IV bottle production. And then a board action on the preventive on the situation, they increase the inspection of glass bottles and increase the number of quality control sample taken. Board laboratories also recommended to FDA, CDC, USP and the major manufacturer of IV solution that measure must be taken to improve sterility monitoring, and standards and procedure has to be developed for IV containers and containers closure. That's all from our group. Thank you.